Dr. Sharaj Jacob from Gastroenterology Associates of Gainesville. I did my medical training in India and had further training in United Kingdom and at Missouri, Columbia. From there, I went on to New Orleans where I had my gastroenterology fellowship training. From New Orleans, I moved to this practice in 2006. The uniqueness of this practice is it is a single specialty practice just for gastroenterology, and we keep the patients at the utmost importance. I live in Flowery Branch with my wife. My son goes to Baylor School of Medicine in Houston. My daughter will be going to UAB School of Medicine. My hobbies are hiking, fishing, and I play soccer, tennis, and badminton. I'm going to talk about Barrett's esophagus. Barrett's esophagus is a condition that affects patients with chronic heartburn. It is seen in about 10 to 15% of patients who have chronic heartburn. The screening for Barrett's esophagus is done by an upper endoscopy with a biopsy of the esophagus. The next question is, who should be screened for Barrett's esophagus? The patients that need to be screened are a male who are over the age of 50, who has chronic heartburn for more than 5 years, and also who have central obesity and who smoke. Once we do the biopsy for Barrett's esophagus, the risk of cancer development varies depending upon the severity of the biopsy. If they have a normal Barrett's esophagus with no abnormal cells, the risk is about 0.2 to 0.5%. And this risk goes up to 0.7 if there are some abnormal cells. If the amount of abnormal cells is very high, the risk can be as high as 7%. Patients with chronic heartburn with Barrett's that can develop esophageal cancer. How do you treat Barrett's esophagus? All Barrett's esophagus patients should be on once daily proton pump inhibitors like Prilosec, Nexium, or Protonix. These patients also need to be on a surveillance, which means they have to have the esophagus looked at and biopsied every 3 to 5 years. It will be wise to see a gastroenterologist who are experienced in looking at the esophageal lining very closely so that a Barrett's esophagus can be diagnosed at the earliest and proper treatment can be provided for the patient.